Reverend Dinkins has over 30 years of preaching and community ministry experience. Since 1995, as founder, president, and CEO of Hosanna Community Foundation, Inc., a nonprofit community outreach organization, he has come to the aid of inner city youth and their families in various areas of need. Hosanna Community Foundation, Inc. is the lead agency to support the research efforts of the Urban Partnership of Miami-Dade County Coalition and the Liberty City Protecting Youth Partnership. Reverend Dinkins combines three evidence-based models in his work. One, strategic prevention framework. Two, evidence to success. And three, collective impact to facilitate comprehensive community planning. This work process implements a behavioral health approach to address risk and protective factors associated with substance abuse, youth academic performance, youth violence, including gun murder, mental health, and collective efficacy. Reverend Dinkins currently serves as the chair for the Miami-Dade Youth Task Force, Liberty City Together for Children Coalition, and program director for the Urban Partnership of Miami-Dade County Coalition, and by the way, and the Liberty City Protecting Youth Partnership. He has a master's in ministry from Jacksonville Baptist Theological Seminary, a master's of public administration from Florida International University, and a bachelor of science in marketing from Southern University in Baton Rouge. Reverend Dinkins is a proud father of Princess Misha Nicole Dinkins, and I wanted to make sure that you knew that. And Dr. Reverend, you're on.
Well, good evening, and thank you for this opportunity. Saddened by the occasion that it came, but nonetheless, I am grateful. I've been a participant of the Melissa Institute from as early as 25, you've been in business 28 years, at least 25 years ago. We've been awed and amazed at the work that you do, and the fact that you're still here providing prevention science education is really amazing. Also want to compliment Wayne Rollins. We go back to Miami-Dade Weed and Seed, where he served as a program director and I as the seeding coordinator. So our years of working together extends over a few decades as well. Work that I've done of the past 9 years has been under federal funding of drug-free community coalitions. It became very clear in Liberty City that substance abuse was not considered to be a major issue. So I've had to incorporate gun violence into the compliance of the drug-free grant. And so the Urban Partnership of Miami-Dade County Coalition seeks to establish collaborations among community residents, community-based public and private not-for-profit agencies, as well as federal, state, and local governments in support of efforts geared toward building stronger families, drug-free communities, leading to better youth outcomes in the 21st century. I, as a person providing leadership for this, conducted within the first few years, implemented what is called strategic prevention framework, which is a framework that involves prevention science method of survey data of the participants, which would be youth. We were able to collect survey data for nearly 800 youth during that time. That gave us a good indication of risk and protective factors as it relates to those youth responses. After we collected the data, of course, we analyzed it, community planned around the data, developed community strategies based upon that data, and then have an evaluation component that involves biannual evaluation of our effectiveness of the strategies that we implement. As we all know, trauma is a part of every life, but gun violence is an additional traumatic event. And people who survive a firearm-related injury may experience long-term consequences. These include problems with memory, thinking, emotional, physical disabilities from injury to the brain, paralysis from injury to the spinal cord and chronic mental health problems from conditions such as post-traumatic stress disorder. So our objective today is following the line with the conference agenda is what we know about gun violence. What does the data say? What we know about public health and prevention science models, and what we know about community plans and proposed solutions. Firearms is a preventable public health tragedy affecting communities across the United States. Each year I attend an annual coalition conference, and all across the nation, we have similar incidences as it relates to gun violence in communities, have similar characteristics across the country. According to the CDC, in 21, 49,000 Americans died by firearms, which is an average of one death every 11 minutes. Over 26,300 Americans died by firearm suicide, 21,000 by firearm homicide, 550 by unintentional gun violence injury, and an estimated 1,000 Americans were fatally shot by law enforcement. So we have the sightings of where this data come from in our slides as well. So in addition, an average of more than 200 Americans visit the emergency departments of for non-fatal firearms each day. So of course, gun violence is a national health epidemic, and the data bear that out. Firearms were used to kill 13,000 people in the United States in 2015, excluding suicide. Approximately 1.4 million people have been killed using firearms in the United States between 1968 and 2011, equivalent to a top 10th largest U.S. city in 2016, falling between the populations of San Antonio and Dallas, Texas. This is over the course of those years, the amount of people who have died as a result of gun violence. When I looked at gun violence definition, it seems to differ from, depending upon who you're speaking with. Wikipedia defines gun violence as violence committed with the use of a firearm. Gun-related violence may or may not be considered criminal, but criminal violence includes homicide, except as justifiable, assaults with deadly weapons, suicide, attempted suicide, depending upon the jurisdiction. And non-criminal violence include accidental or unintentional injury and death, except perhaps in cases of criminal negligence. CDC, when I look for their definition of gun violence, the way they define it is firearm violence and injury prevention is how gun-related violence is termed within the CDC. A firearm injury is a gunshot wound or penetrating injury from a weapon that's uses a powder charge to fire a projectile. Weapons that use a powder charge include handguns, rifles, and shotguns. Injuries from air, gas-powered guns, BB guns, and pellet guns are not considered firearm injuries, as these types of guns do not use powder charge to fire a projectile. What I thought was interesting is that whenever we talked about gun violence on a national level, my perspective from a community level, primarily based upon the data of presenters who came in the early morning, particularly the state attorney's office. They gave us a local picture where this data, where these shootings are occurring. I was intrigued and remain intrigued because across the nation, there seems to be similar kind of characteristics in communities where community violence is occurring. Shootings are occurring primarily among African Americans, killing African Americans. So I was intrigued when I looked at the way we define firearm violence or gun violence. That particular population never really showed up in the conversation. There are many types of firearm injuries which can be fatal or non-fatal. They list them as intentional, self-inflicted, unintentional, interpersonal violence, legal interventions, undermined intent. Key notes: no definition identifies inner city gun violence as gun violence or as an emphasis to address or to reduce, which may speak to our history as Americans in terms of how we treat our African citizens in terms of systematic racism, systematic exclusion, proven through our practices as redlining, and of such disproportionate arrest rates in communities for people of color. So gun violence is a national public health epidemic. However, it is preventable. Prevention science has provided a framework whereby we can use science to reduce gun-related violence. The focus of public health is on health, safety, and well-being of entire populations. A unique aspect of the approach is that it strives to provide the maximum benefit for the largest number of people. Public health draws on a science based on the science base that is multidisciplinary. It relies on knowledge from a broad range of disciplines, including medicine, epidemiology, sociology, psychology, criminology, education, and economics. This broad knowledge base has allowed the field of public health to respond successfully to a range of health conditions across the globe. What I've observed in my community work is that all of us look at the work based upon our skill set or our agency aim. And though it's all relevant, I've yet to see plans that approach the work from the perspective of the community, that includes the community as the key task or the key component or variable about which we should respond around in terms of understanding why does gun violence seem to only occur in African-American communities. Really understanding that at the root cause or the root cause of that, and then developing community strategies that address those root causes is what public health approaches would do. So the public health approach emphasizes the input from diverse sectors, health, education, social service, the justice departments, policies, and but more importantly, the community members. Very often, community members have little to say about what interventions are provided for them in the form of services in communities. And one of my greatest awakenings in doing this work is to understand that oftentimes as a service provider, what we think the community needs and wants is not how the community see the problem. Very seldom has been our experience over the years. We've learned over the years is that we come to the problem, meaning us as professionals, with our middle class perspectives on what the community should embrace. And oftentimes the community has a completely paradigm or completely different set of values that guides the way they conduct themselves in the community. So including them in the planning process could be very vital in not only understanding the mindset of the community, but also implementing strategies that will work, implementing strategies that the community can see their input and the community take ownership and become a part of it. So the collective action on the parts of these key collaborators can help address problems such as violence. But when you talk about public health approaches, there's three elements. The focus on prevention, it is prevention, and prevention will be defined as addressing the problem as far as you can upstream. What we know about many of these families, as has been pointed out by the state attorney's office, is that the young people who are standing behind the guns, their life issues started long before they pulled the trigger. And so identify those families earlier in life and provide the kind of social services, and I'm almost afraid to use the word services and programs, because we've been doing that for years, and yet we struggle with proving how effective we are at reducing gun violence and other social deterrents in our community. I like to use the term strategies, right? And those strategies include not only focusing on prevention, this public health approach, but also focusing on scientific methodologies that help us identify what the risk and the behavior patterns are of the community. So prevention science does not lend itself to us assuming what the issues are, but what drives the interventions is the data response from the clients as they respond to the tool that we will implement to gain information about their attitudes and behaviors in the areas of our interest. And then the way we develop a comprehensive plan, our community plan, is through this multidisciplinary collaboration to address the issues. And working with partners in the community over the years has proven to be challenging from the perspective of different definitions about what it means to partner and what is the commitment in the partnership. As I said earlier, providing services is great, but what research has proven, what research says really works for young people is a theory called social development strategy. Young people having positive relationships with adults, positive adult role models who share skills and ways and pattern for them ways of resilience that has been most effective in supporting children who are often in family dynamics that are severely dysfunctional from the time they came to know themselves. And in many instances, street and jail could be better than what their family situation is. And so many times partners fail to understand that or embrace that, as well as be willing to take the risk to really meet those clients where they are and be patient enough to allow them to develop the kind of trust that's necessary to embrace a new way of living. So the public health strategies are designed to interrupt the connection between three essential elements: the agent, which is the source of injury or weapon, the perpetrator or perpetrator. So what is the mindset of families that participate in gun-related violence behaviors? Our data have shown over the years, and meaning community level data of the Urban Partnership of Miami-Dade County has shown that the young people are the families that's involved in gun violence. It is a lifestyle. And very often it is an intergenerational lifestyle. When Hosanna, was a part of group violence intervention serving 116 clients that we did serve, it was clear to us, based upon the way we collected data, that over 90% of the shootings in Miami-Dade County were the result of family feuds between families that lived over town and in Liberty City. But our interventions oftentimes provide services, but fail to identify the deeper reasons of why and interventions that address the why. Public health approaches push us or prompts us to address the issues from that perspective. And number two, the host, the injured person. What happened? Time to understand what happened to them and collect the data over time to be able to develop environmental strategies that helps the masses of these young people who are within these environments where these injuries occur, where these shootings occur. Once again, gun violence or inner city gun violence is not happening in every community in Miami-Dade County. In fact, as the state attorney's office has stated, it happens primarily in communities of color. And so it becomes a public health approach to ask why. And then after understanding the collecting data of why, understand the risk and protective factors, we work to reduce the risk factors and improve the protective factors in those communities. Over the years, the Urban Partnership of Miami-Dade County in our community planning and implementation of interventions, we've used prevention science models. And because gun violence is so complex, it took us several years to kind of understand how can we address this. It's too complex, it's too large, we can't put our arms around it. So prevention science taught us risk and protective framework models, and of those domains, family, school, individual, and community, we sought to focus our emphasis on families, primarily because children respond to their environment based upon how their parents respond to their environment. And for many of the children in our communities, at least in Liberty City, as a result of the youth surveys the Urban Partnership did in 2016 and 2017, 60% of the youth, of that 800 youth, expressed that they are being raised by parents who have an incarceration history. 30% of that 800 youth said they have seen their parents resolve conflict with another person with the intent to harm using a gun or knife with the intention to harm them. And so doing this work for us, or for me as a preventionist, sharing this and trying to develop community movement, a community power to be able to influence the governments and systems that make investment decisions toward youth has been very challenging. But we've been able to stand our ground because of using this public health approach. And in so doing, this process has a way of reducing powerful leaders and agencies from dictating the course of the work, which happens oftentimes when the work is agency-led. The agency has a mission and a goal. The agency sees things in a particular manner, and that's where they place their investments. So using this prevention science method positions communities to leverage its community power. And when we speak of community power, we're speaking of the community ability to use its influence to affect the kind of change that it needs within its community based upon its individual community level data. One thing we know about data is that if at the county level, state level, national level, that data is bad, we can assume in African-American communities, then it is toxic. It's that much more severe than just being bad. And very seldom do we have community level data that addresses or exposes the real deficiencies, health deficiencies, economic deficiencies, and otherwise within these communities where this high frequency of violence is occurring. What I have before you now is the adverse childhood experience chart And in our community, based upon the 116 clients we serve when we serve group violence intervention, and now serving, doing the work from a prevention lens with the Children Trust funded FNSP award, our young people in that community are 4 higher. The community is a 4 higher, which has correlation to other kind of health and other kind of issues as it relates to living a healthy life. But on the surface, you know, all of us have experienced to some extent, you know, parents being divorced, or in this community, kids having incarceration. There's a large population of homelessness, domestic violence, substance abuse. So a lot of our families and those of us who are leaders serving in the community have had these adverse childhood experiences. That's on the surface. But underneath at the broader level are these other community environment types of things that the community as a whole has to deal with: poverty, discrimination, community disruption as a result of violence and other things, lack of opportunity, economic mobility and social capital, violence, poor housing, quality and affordability. But yet, in the midst of these challenges, we found that through proper community planning and proper support for young people, if we work to build resilience, community level resilience, though we have in this work, the Urban Partnership in Miami-Dade County through the Liberty City Protecting Youth Partnership, and ultimately working to get together for children to see that this is a more effective way to go about doing prevention, and prayerfully be able to gain the support of the mayor's office and the county so that we can coordinate what group violence intervention is doing with a more robust, intentional prevention side that address not all youth in general, but specific youth who are in families that have been identified at risk of being involved in gun violence. And we know that we can identify them. Some of our community challenges lies in the fact that we still operate in soloic kinds of environments, oftentimes reluctant to share referrals, and oftentimes our work, we lack the trust that's needed among each other to really develop an integrated system of care to address the real needs of young people much earlier. For example, if we were able to identify, say, for example, group violence intervention identified a shooting in a family, and the person was identified at the hospital bedside, but yet that person receives services, but that whole family actually needs services. The trauma did not just happen to the person that was shot. It happened to the whole family. And being able to make referrals to Liberty City Protecting Youth Partnership, we are able to provide those services to the whole family. That involves the strengthening components, developing within the life of those family members, the strengthening components as they are identified through the King's assessment tools that TCON rolls out before us as preventionists. And so resilience is the ability to bounce back when things don't go as planned. Resilience not only has to happen for this type of planning to become a long-term sustainable approach within communities, but communities, youth, and families have to develop this sense of resilience to be able to overcome the challenges that arise as a result of trying to do prevention in this way. It can help you manage or even ward off conditions such as depression and anxiety and improve your mental health overall. And if you've had an existing mental health condition, being resilient can lessen its impact and help you recognize when you need support. I can tell you on a community level, doing this work, there have been days I've laid down at night unsure as to whether or not the community partners that is needed will come to the table, would be willing to partner in a way that really facilitates the development of a system of care that has a continuum of care as practice. And only to discover that over time, it does come to pass. If you don't give up, you keep pushing forward. And for me, recognizing that it's not about me, it's about the will of God. And if I about that work, just being steady with the work He's assigned our hand, things do come together. So community resilience is the capacity of a dynamic system, community system, to adapt successfully to the disruptions that threaten system function, viability, or development. So the resilience theories focus on the actions of emotive factors, positive situational, social, and individual characteristics that have the potential to interrupt a negative life course. Three broad categories have been identified as areas to build resilience. Work to create safe, protective, and equitable environments. That's something we all desire. The way we go about it may be slow in process. We talk about it, but oftentimes our practices does not lend itself to our talk. Presence of positive relationships. Everything that happens in life is centered around relationships. For many of the youth that we've worked with that's involved in gun violence, very few of them have had positive adult to child relationships that were sustained to the point where positive values were transferred, and trust and belief and optimism about their future was a seed that was nurtured. So the healthy development of social and emotional youth and families is the foundation of the work. We've discovered in this work that most often parents are less willing to do the necessary day-to-day grind of changing their lifestyles. But our focus is for the children to fill their life with pro-social activities that will facilitate in them a love for learning, some focus about what they want to be in terms of their adult life, and then support them along the way to accomplish the goals that we express to them that they're capable of accomplishing over the course of their life. So our theory of change is based upon sound prevention science. Thus, the prevention hypothesis is if community coalitions provide an integrated array of ongoing data-driven social development strategies and programs, integrate academics and family mentoring support systems to the same children and families over time, complemented by coordinated environmental strategies and legislative advocacy. It will build and empower communities to sustain its local system of care, facilitating resilience in youth and families, better inclinating them for healthy lifestyle choices and overall wellness over the course of their lifespan. Community goals would include increase indigenous community collective prevention capacity, improve legal juvenile systems coordinating with community partners within indigenous community, within each indigenous community among its service providers, improve public school and community prevention partner relationships, creating a collective efficacy within school culture between the different schools levels, elementary, middle, and high, because this population is a very small population, and if we're able to address who they are much earlier and give them the kind of supports, though it may take time, it may not change the adults, but it does provide the youth with a exposure to alternative values and lifestyles. And it is I believe that many of the youth will choose a different lifestyle if they understand what that lifestyle is and they're supported along the way. So we want to improve protective factors on the environmental level, conduct, that's conducive to positive youth development. We want to improve youth outcomes in education, reduce incarceration, crime, violence, and improve employment. Create prevention care coordinating systems in each indigenous community using a prevention science model. We believe that it takes a village to raise a child. Many of the African-American communities where this is now occurring, our most affluent leadership over the years have moved out, and the understanding of how to access systems and bring about the kind of change that is needed is a void, and we've tried to do it. We're trying to do it here through community-based agencies. In time past, it was done through our churches, but today churches seems involvement in social justice seem to be very minimal. We want to develop community strategies where we create these safe havens to facilitate youth development at all appropriate phases of youth development life, and develop community strategy plans that address risk factors and indicators in the areas of education, antisocial behaviors, violence, and substance abuse. And with that, I've kind of come to the end of my sharing of what we believe is possible and what we have been doing as a community coalition through the Liberty City Protecting Youth Partnership and in partnership with Together for Children of the Liberty City community. All of these systems require us to abide within a process that often takes time to do. What I often consider to be the most simplest thing can take the longest amount of time. But we're here. This is what we bring to the community. This is the work we've been doing for the last 15 years.